Imagine if treating one life-threatening disease could increase your risk of developing another. Sounds like a nightmare, right? Unfortunately, this is the reality for many men with prostate cancer. Researchers have been studying the link between prostate cancer and Alzheimer's disease, and what they found is both surprising and concerning. It turns out that men with prostate cancer are at a higher risk of developing Alzheimer's. And it's all connected to a common treatment for prostate cancer. So what's going on here and what can we do about it?
The standard treatment for prostate cancer is called androgen deprivation therapy, or ADT for short. It's a hormone therapy that reduces testosterone levels in the body, which can help slow down the growth of prostate cancer cells. However, this treatment has some unintended consequences. Researchers at the Medical College of Georgia at Augusta University have found that ADT can actually increase the risk of developing Alzheimer's disease. But how is this possible? It all comes down to the way ADT affects the brain. When testosterone levels are reduced, it can lead to an increase in amyloid metabolism and the formation of plaques associated with Alzheimer's. It's like a domino effect, where one treatment can trigger a chain reaction of negative consequences in the brain.
To study this link, researchers used animal models to investigate the relationship between ADT and Alzheimer's. What they found was shocking. The treatment led to an increase in pro-inflammatory cytokines and a decrease in anti-inflammatory cytokines. This means that the immune system is actually contributing to the development of Alzheimer's rather than fighting it off. But that's not all. The treatment also damaged the blood-brain barrier, allowing immune cells to infiltrate the brain and cause even more inflammation. It's like a perfect storm of negative effects, all triggered by a treatment that's meant to help patients with prostate cancer.
But here's the thing. This research isn't all doom and gloom. The study also found that a drug called natalizumab could potentially treat the negative effects of ADT. When researchers gave this drug to mice undergoing ADT, it reduced the infiltration of immune cells and improved cognitive function. This is huge because it means that we might have a way to mitigate the risk of Alzheimer's in men with prostate cancer. And that's exactly what the researchers are hoping to do next. They're planning to conduct a clinical trial in patients with prostate cancer who are undergoing ADT to see if this drug can make a real difference in their lives.
So what does all this mean for men with prostate cancer? The good news is that researchers are working hard to understand the link between prostate cancer and Alzheimer's. The bad news is that this link is real and it's something that patients need to be aware of. But with more research and more treatments on the horizon, there's hope that we can reduce the risk of Alzheimer's in men with prostate cancer. And that's something to be excited about. The study's findings were supported by funding from the National Institute on Aging. And it's a great example of how research can lead to real breakthroughs in our understanding of complex diseases.
In conclusion, the link between prostate cancer and Alzheimer's is a complex one, but it's also an important one. By understanding how treatments like ADT can increase the risk of Alzheimer's, we can start to develop new treatments that mitigate this risk. And that's exactly what researchers are working towards. So, let's keep the conversation going and raise awareness about this important topic. Who knows, we might just find a way to beat both prostate cancer and Alzheimer's in the process.